Today we're going to talk about the skeletal system. The skeletal system is made up of active living tissues, including bone, cartilage, and other connective tissues, nervous tissue, and endothelial tissue and muscle in the walls of its blood vessels. The cells of skeletal tissues must have nutrients, oxygen, and energy to carry on metabolism. The skeletal system functions closely with the muscular system. The next several slides have combining forms or root words for the musculoskeletal system. This slide has combining forms or root words for the joints of the musculoskeletal system. This slide has prefixes related to the musculoskeletal system, suffixes related to the musculoskeletal system. This slide shows various types of body movement, and this slide shows abbreviations related to the musculoskeletal system. The skeletal system has multiple functions. First, support. The skeletal system supports the body by serving as a bony framework for the other tissues and organs. Next is protection. The skeletal system protects delicate vital organs. Next is movement. Bones serve as levers that transmit muscular forces. Next is blood production. The red marrow within some bones produces blood cells. Finally, mineral storage. Bones store and release minerals such as calcium and phosphorus. When the concentration of calcium in the blood increases above normal, calcium is deposited in the bones. When the concentration of calcium decreases, calcium is withdrawn from the bones and enters the blood. These actions, which are regulated by hormones, help maintain homeostasis. Muscles are attached to bones by bands of connective tissue called tendons. Bones are held together at joints by bands of connective tissue called ligaments. A joint is the junction between two or more bones. Most joints are movable. Bones are hard, rigid structures that are made up of living cells. Calcium and phosphorus are needed for bone formation and strength. The human body has 206 bones. There are several types of bones. Long bones bear the body's weight, for instance, the femur. Short bones allow skill and ease in movement. Examples are the fingers, ankles, and toes. Flat bones protect organs, for instance, the ribs, pelvic bones, and shoulder blades. And finally, irregular bones are the vertebrae and spinal column, which allow movement and flexibility. Structure of bones. The main shaft of a long bone is known as its diaphysis. The expanded ends of the bone are called the epiphysis. In children, a disc of cartilage, the metaphysis, is found between the epiphysis and diaphysis. The metaphysis are growth centers. At maturity, they become vague epiphyseal lines. At its joint surface, the outer layer of a bone consists of a thin layer of articular cartilage. Each bone is covered by a layer of specialized connective tissue called the periosteum. The inner layer of the periosteum contains cells that produce bone. A long bone has a central marrow cavity filled with fatty connective tissue known as yellow bone marrow. The marrow cavity is lined with a thin layer of cells called the mediastinum. This slide shows the structure of a long bone. There are two types of bone tissue, compact bone and spongy bone. Compact bone is dense and hard. It's found near the bone surfaces where great strength is needed and consists of interlocking spindle-shaped units called osteons. Mature bone cells called osteocytes are located within each osteon. They are found in small cavities called lacunae. The lacunae are arranged in concentric circles around the osteons. Blood vessels that nourish the bone tissue pass through these canals. The osteocytes are connected by thread-like extensions of their cytoplasm. Next is spongy bone, which is found within the epiphysis and make up the inner part of the wall of the diaphysis. It consists of a network of thin strands of bone. The spaces between spongy bone are filled with bone marrow. In adults, bone marrow is found mainly in the bones of the skull, the vertebrae, ribs, sternum, clavicles, and pelvis. Blood cells are manufactured in red bone marrow. This marrow is also an important site of antibody production. Bone formation is called ossification. Osteoblasts are the cells that produce bone. When osteoblasts become embedded in the bone matrix, they are called osteocytes. Osteoclasts are very large cells that break down bone. During fetal development, bones form in two ways. The skeleton of a fetus consists mainly of cartilage. Long bones develop from cartilage templates in the fetus, which is a process known as endochondral bone development. A bone begins to ossify in the diaphysis. Secondary sites of bone productions include the epiphysis. The area of bone between ossified regions grows, and these regions eventually fuse. In contrast, the flat bones of the skull, the irregular vertebrae, and some other bones develop from non-cartilage connective tissue scaffold. This process is called intramembranous bone development. Osteoclasts and osteoblasts work side by side to shape bones and to produce the precise grain needed in the finished bone. The bone matrix is the intercellular substance of the bone that forms the mass of most of the bone. It consists of inorganic and organic substances. The axial skeletons consist of the skull, vertebral column, ribs, and sternum. It is 80 bones. The skull, which is the bony framework of the head, consists of 22 bones grouped into two sets, the 8 bones of the cranium and the 14 bones that make up the face. Also, within the head are 6 very small bones, the auditory ossicles, which are found in the middle ears. Most of the bones in the skull are joined by immovable joints called sutures. Certain cranial bones contain sinuses, or air-filled spaces lined with mucous membranes. The vertebral column or spine supports the body and bears weight. It also surrounds and protects the spinal cord. The vertebral column consists of 24 vertebrae and 2 fused bones. The regions of the vertebral column are the cervical or neck region, composed of 7 vertebrae, the thoracic or chest region, which consists of 12 vertebrae, the lumbar or back region, which is composed of 5 vertebrae, the sacral or pelvic region, which is a single bone, the sacrum, composed of 5 fused vertebrae, and the coccygeal region made up of 3 to 5 fused vertebrae. Vertebrae articulate with each other by means of joints and by means of intervertebral discs composed of cartilage. The intervertebral discs are shiny pads that act as shock absorbers. A typical vertebrae consists of 2 main parts, the centrum and the neural arch. The anterior region is the centrum or body. Each centrum is padded by an intervertebral disc. The posterior curved region of the vertebra is the neural arch. The lateral regions of the posterior part of the vertebrae are the laminae. The transverse processes are lateral projections from the centrum. Transverse processes have articular surfaces for connecting with other vertebrae and ribs. The centrum and neural arch enclose a large opening called the vertebral foramen. The adjacent vertebral foramina from the spinal canal, which contains the spinal cord. A spinous process is a projection from the laminae that allow the vertebrae to attach to ribs, muscles, and other vertebrae. The thoracic cage or rib cage is formed by the sternum, thoracic vertebrae, and 12 pairs of ribs. This bony cage provides support for the bones of the pectoral girdle and upper extremities and is important for breathing. It protects the inner organs of the chest and abdomen. The appendicular skeleton consists of the bones of the upper and lower extremities, plus the bones making up the pectoral girdle and the pelvic girdle, with the exception of the sacrum. Each half of the pectoral girdle consists of a scapula or shoulder blade and a clavicle, collarbone. The pectoral girdle articulates with the sternum, but not with the vertebral column. Each upper extremity consists of 30 bones. The humerus, or upper arm, the ulna and radius in the forearm, 8 small carpal bones in the wrist, 5 metacarpal bones in the palm of the hand, and 14 phalanges in the fingers. Each thumb has 2 phalanges, and each finger has 3 phalanges, a distal, middle, and proximal. The pelvic girdle is a broad basin of bone that encloses the pelvic cavity. The pelvic girdle supports the lower extremities and is the site of attachment of major muscles of the trunk and lower limbs. The hip bones are called the coxal bones. The coxal bones, together with the sacrum and coccyx, form the pelvic girdle. Each coxal bone is formed from the fusion of 3 bones during development. The largest of the 3, the ilium, lies on top of the other 2 bones. The most posterior bone is the ischium. The anterior bone is the pubis. The joint where the coxal bones come together anteriorly is the pubic symphysis. The lower extremity consists of 30 bones: the femur or thigh bone, the patella or kneecap, the tibia and the fibula, the lower leg bones, 7 tarsal bones in the back of the foot and heel, the 5 metatarsals, and then 14 phalanges in the toe. Each great toe has 2 phalanges, while the others have 3, distal, middle, and proximal. The pelvic girdle consists of a pair of hip bones, also known as the coxal bone. Each bone is made up of 3 individual bones that fuse together over the first 20 years of life. Each coxal bone is formed from the fusion of 3 bones during the development. The largest of the 3, the ilium, lies on top of the other 2 bones. The most posterior bone is the ischium. The anterior bone is the pubis. The joint where the coxal bones come together anteriorly is the pubic symphysis. A joint is a point of contact between 2 bones. There are 3 classifications of joints. Synarthrosis is connect bones by means of a thin layer of fibrous connective tissue that may be replaced by bone in an adult. An example is sutures that join skull bones. Amphiarthrosis permits slight movement and help absorb shock. In this type of joint, the bones are joined by cartilage. So for instance, the joints in the vertebral column. Diarthrosis, also known as synovial joints, are flexible joints. The ends of bones forming a diarthrotal joint are covered with cartilage that lacks any sort of covering membrane. This articular cartilage also lacks nerves and blood vessels. The joint is surrounded by a connective tissue capsule, the joint capsule, made of tough fibrous connective tissue. The joint capsule is typically reinforced with ligaments, bands of fibrous connective tissue that connect bones and also limit movement of the joint. The joint capsule is lined with synovial fluid, which reduces friction during movement and reduces shock. Fluid-filled sacs called bursae are located between bone and tendon and between bone and some other tissues to cushion movement. Here are some types of synovial joints. So a hinge joint, the motion is in one plane only, so it permits only flexion and extension. An example would be the elbow and the knee. Ball and socket joints permit the widest range of movement, including rotation. Examples would be the shoulder and the hip. A pivot joint allows rotation. An example would be the joint of the first 2 cervical vertebrae. A saddle joint permits a wide range of movement. Examples would be carpometacarpal joint of the thumb. A gliding joint is when one bone glides over another without circular movement. For instance, the carpal joints of the wrist and the tarsal joints of the ankle. Condyloid joints allow angular movement. For instance, the joints between the metacarpals and the phalanges. There are multiple age-related changes that can occur to the musculoskeletal system. First is osteoporosis. That's a bone disease that develops when the mineral density and bone mass decrease, or the quality or structure of the bone changes. The bones become weak and break easily. Next is loss of muscle mass. When that occurs, muscle cannot support the body. It causes weight loss. Next is arthritis. That's caused by decreased range of motion and causes decreased range of motion and slower body movement. And finally, lost height. That occurs because the space between the vertebral disc decreases. Some things that the CNA should report to the nurse related to the musculoskeletal system are falls, any area of the body that is swollen, red, bruised, or painful to touch, any complaints of pain when a resident is moving a joint, range of motion for a joint that has decreased movement, and if a resident limps or has pain when walking or being repositioned.